Hello guys, so today we shall be discussing another infection that would be Tinea Versicolor, right? So we shall be discussing about Tinea Versicolor. Now Tinea Versicolor, it is caused by what? Obviously this is a fungal infection, right? It is a fungal infection. This is most commonly seen. I hope all of you have seen this condition, right? So this is mainly caused by a fungus that is called as Pityriasis Versicolor, right? So it is caused by Pityriasis Versicolor. Now what is the important thing you need to see? Within this Tinea Versicolor, there are two types of patches, right? So one kind of lesions, they are hypopigmented lesions, and the other kind of lesions, they are called as hyperpigmented lesions. So one kind of lesions are hypopigmented lesions, hypopigmented. Other kind of lesions are hyperpigmented. Another important thing you need to know is that in children, the rash development or the progression of rash will be different from the adults. How? In children, most commonly you would see this rash in the face. I mean, you would see those hypo or hyperpigmented lesions in the face, right? So you would see this type of rash in the face. But whereas in adults, that rash you would see in extremities, trunk and extremities. You would see in trunk and extremities leaving the face. Okay, you would see that rash in trunk and extremities leaving the face. So this is very important for your MCQs. In the children you would see it in the face, whereas in the adults face is spared, right? Trunk and extremities you see this. And as I already told you, this rash is of two types, hypopigmented as well as hyperpigmented rash, right? Now another important thing is that either whenever the patient has got this rash because of Tinea Versicolor, this rash is characterized by presence of pruritus or absence of pruritus. There can be itching, there cannot be itching also, right? So there are cases where patients experienced pruritus and there are cases where patients did not experience any pruritus. So there might be pruritus. Can I write it like this? There can be pruritus or there cannot be pruritus. Not only that, this is a flat rash, right? Sometimes there can be scales on that. I hope you understood what are scales, right? So there can be scales, there cannot be scales sometimes. So there can be these fine scales. Sometimes there can be no scales. So when you do the diagnostic part, so how do you do the diagnosis is that you scrape that region and add KOH to that. And you add KOH preparation to that. So after that, what do you see is that, see, for example, if I've got some rash over there, I scrape that lesion, okay, I scrape that lesion and then I take that and I put it under a microscope, I add some KOH, right, and then when I look under the microscope, I will find hyphae. Why will I find hyphae? Because this is a fungal infection, right? So I would find hyphae. So in fungal infection, what can we expect other than in addition with the hyphae? In addition with the hyphae, we can also expect yeast cells. So these hyphae and yeast cells, they are arranged in spaghetti and meatball appearance. They are arranged in, I'll show you the picture. Spaghetti and meatball appearance, right? So look at the picture here, guys. So this is a KOH mount. This is the KOH preparation. KOH preparation, right? So here I can see few important things. See, I can see these meatballs. These are called as spaghetti meatballs, and I can see these long chains like this, right? These are nothing but called as the hyphae. Okay, so I can see hyphae as well as these spaghetti meatballs. Spaghetti meatballs. So what will be the treatment which I can give to the patient here? Yes, what will be the treatment which I give to the patient? The treatment will be basically ointments, right? So I will be giving topical ointments like topical terbinafine. Not only that, I should also give topical ketoconazole. Right? So this is the basic treatment which I give to the patient.